The learning objectives of our presentation include the importance of nutrition and its impact on aging, how OTs can help educate others in nutritional intake, and how to incorporate vegetables and fruits into your diet via smoothies. It is estimated that disease-related malnutrition costs the U.S. $157 billion annually, with older adult malnutrition costing $51.3 billion per year. Maintaining a good nutritional status has significant implications for health and well-being, delaying and reducing the risk of developing disease, maintaining functional independence, and therefore promoting continued independent living. The number of older adults engaging in health promotion, management, and maintaining programs has increased over the past decades. More than 90% of older adults are currently living with at least one chronic condition, and about 75% live with multiple chronic conditions. The issues lie in that some people with chronic conditions have difficulty following through with self-management health promotion recommendations. Research shows that having multiple chronic conditions in older adults are associated with decreased health-related quality of life and decreased occupational performance. Consuming a healthy, balanced diet is important for general health, maintaining a healthy body weight, and reducing the risk of a range of conditions, including heart disease, stroke, cancer, diabetes, and osteoporosis. It is important to understand why there is such a commonality between older adults and their lack of nutrition. As stated, the common misconceptions about what store-bought juices are providing is challenging enough. In addition, the ingredients listed on the bottles are too small for a typical aging adult to read. The act of going to the supermarket also becomes overwhelming and discourages older adults to engage in the activity. We also have to consider the life challenges occurring, such as dealing with loss of partners or close friends, and biological changes to appetite. Many elderly men who are left widowed are typically dependent on their partner for advice and support regarding food and health. Having to work through the grief and take on new challenges increases the likelihood of a poor diet.
Our wellness program aimed to decrease the number of elderly individuals who are struggling to maintain a nutritional diet by introducing the benefits of making ingredient-specific smoothies. Previous studies have indicated that by incorporating a healthy diet, brain health can increase, which in turn decreases age-related cognitive deficits, pain, or low energy experienced with normal aging. Smoothies have been perceived as a convenient, easy, and time-saving way to incorporate the daily intakes of fruits and vegetables needed to maintain a healthy diet. Research shows using raw, fresh, or frozen vegetables is the best way to get the most nutrients from these foods, and combining them all in a blender allows for a low-effort way to pack in the necessary nutrients needed to their diets. We discuss with our clientele the importance of proportions and combination of ingredients being used in order to make a smoothie that is most beneficial to their needs. Research states that by focusing on using foods high in vitamins that you're currently deficient in and combining it with water or milk is the best way to make a smoothie. It is recommended to use honey instead of sugar to increase sweetness if needed, in order to avoid a high intake of sugar with each smoothie. So how do OTs address nutrition with clients? Nutrition is important for health management and maintenance, as well as the prevention of secondary conditions. Although occupational therapy practitioners are not qualified to give advice on specific dietary needs, OTs can educate clients about the benefits of eating nutritious foods consistent with the recommended daily intake amount. Occupational therapy practitioners often are part of the team working with people with multiple chronic conditions. Therefore, they support patients to engage in self-management activities by helping clients establishing, restoring, and maintaining self-management techniques with a focus on health-promoting routines and habits.
First, we visited our local community center, Regal Park Community Center, and spoke with our director about the clientele at the senior center. She informed us that currently the residents are interested in exercising and nutrition. Given the information she provided us with, we did research on how nutrition impacts older adults. Upon doing our research, we found out that a lot of elderly individuals do not intake the recommended amount of fruits and vegetables. The reason for their lack of nutritional intake varies. However, studies show that their biological changes in appetite and chronic illnesses also impact nutritional decisions made by older adults. We then discussed on researching an easy alternative to consuming fruits and vegetables, which is when we found numerous articles that talked about smoothies and specific fruits and vegetables that help decrease common symptoms associated with chronic illnesses such as low energy, joint pain, and inflammation. Our group then found recipes that included these specific fruits and vegetables. For our presentation, we made 3 different smoothies to help boost energy, decrease inflammation, and decrease joint pain. We also did a quick PowerPoint presentation educating our clientele on the importance of nutrition and shared research that we found to support our claim. In addition, we gave out pamphlets which included the ingredients of the smoothies that were made so that they can make them themselves when they're home. Our clientele were extremely thankful and interested in our educational presentation. After our presentation, a handful of them stayed to ask us questions about the ingredients we used and wanted further information on those ingredients, such as where they could buy the ingredients or how long they can keep a juice in the fridge for. The individuals also stated how surprised they were on how good the smoothies tasted despite all the vegetables that were in it. Given the questions that were being asked by the older adults, we thought that they were interested and absorbed all the information that was presented. They even asked us for seconds. In the future, we would hand out a list of vegetables and fruits and the amount of vitamins contained in each of them, and include the benefits of every fruit and vegetable listed so that clientele can make their own combination of whatever vitamin they are deficient in. Overall, this presentation went better than expected. It was rewarding to see how much our group enjoyed and appreciated what we were doing, and we learned the importance of using therapeutic use of self in order to make dry research material entertaining but informative.